Good morning. Thank you for the introduction. And, well, what is cross-border public services, the project about? The big question. Just imagine a Europe in which it doesn't matter whether a conservation area is located within a country or stretches across the border. Imagine a Europe in which it doesn't matter if you have an accident, where you have the accident, in which country, and what nationality is your nationality. And you will be transported to the next appropriate hospital on either side of a border. Just imagine a Europe where your children do not have to travel maybe 1 hour by bus to their next secondary school because that is the next school in your region if there is an appropriate as good school just across the border. So our project is about providing a very, very tiny little bit contribution in order to make borders matter less in Europe. In the following, I'll show you first what our stakeholders expect from us in order to achieve that. I'll tell you a little bit why we can provide only a very tiny little contribution, and then show you where partly this has been achieved already in Europe and what has been achieved by showing some empirical findings. So, what are the key questions? Our stakeholders are interested firstly into some stock taking, about learning about cross-border public service provision in Europe, and of course, in particular, about the provision in their regions. And here we look much more in depth in what is provided there, in the how, in the why, to understand also their future needs. And of course, they want to get some initial steps towards future service provision in their border areas. And this is what we are working about in the next phase. So far, our stakeholders have highly appreciated what we have done during the first 6 months of the project, but the critical phase is ahead. Just as of today, we are starting the regional workshops in 10 cross-border regions for the next 3 weeks, so we have a tight schedule there. And during that period, we will work on the future development, initiate a few developments, and of course develop recommendations together with them. This doesn't go without challenges, lots of challenges. I have just listed here the top 5 I would say we have encountered so far. Just let me mention 2 of them. The very first, what are cross-border public services? This really is not all that easy. Together with our stakeholders, we developed criteria to find as consistent definition for identifying the services as possible. And let me quickly jump to timing. There are several issues regarding timing. The first, above all, is the issue of the project length of such a study and the time you need to really achieve something when you want to develop cross-border public services, even if you want to advance and improve existing ones. And the second one is the resources the stakeholders are having. They are very pragmatic in helping us, and we have good communication established, also by the help of the AEBR, which acts as a roof organization for our stakeholders as well as our help desk. But it still is not a compulsory task for the stakeholders, which shows what the role cross-border public services are still having in Europe. No, now my time is over. I don't know why. You're not the key one. This is something, it's probably, here it goes. Thank you very much. First empirical findings, tentative ones. No. I was probably too fast, I don't know. I wanted to speed up. As you can see from that graph, cross-border public service numbers have been steadily increasing over the past decades. The new numbers of new CPRs has been increasing further in recent years. Nevertheless, the development is quite uneven across Europe, as should be shown on the next slide, if it ever comes up. Here it is. You can see that they are apparent already all over Europe. The red border lines show borders where we find a lot of or several cross-border public services, high density. The green borders are those where we find very, very few cross-border public services. Where are they concentrated? Firstly, in regions where we have a long cross-border cooperation tradition. Secondly, in regions both with high population density, because there's a high demand, and also in regions with very low population density. Why is that? Often here, cooperation creates a critical mass, and naturally, also small countries are also more often interested in establishing cross-border services, because then they have a better outreach. And the map illustrates another problem we are having, because it's very difficult to collect really data for all of Europe here. There hasn't been any database before, and you can see when you look very, very clearly there that some of our case study areas pop up. They pop out from their neighborhoods. That is because we could spend more time there to really search for all and everything that is out there. We differentiate, of course, also the types of services. Would be boring a little bit otherwise. We have services in 9 policy fields, and we further divide them within roughly 40 fields of intervention. And all the bluish, greenish spots and lines here indicate the majority of services we found, and they are located just in 3 policy fields, namely environmental protection, disaster management, civil protection, as well as transport. So let me quickly go to 2 of our 10 case studies to show you a few more details just for illustration, because our case studies represented by the stakeholders look very, very differently. The first one is from an old internal border with a very long tradition of cooperation, the BothinanArc at the Swedish-Finnish border. And here you can see what really shapes the potential for cross-border public services. We have quite low barriers when it comes to culture, language, similar economic development, but the geographic distances, they really matter. This is also why, so far, the cross-border public services in a high density and many different fields that is not even visible really with colors, just with numbers here, concentrate in the border cities of Haparanda and Tornio. And this is why our stakeholder is there very interested in expanding services to a wider area, in particular in the field of joint education and the fields of secondary and university education, to expand transport services for overcoming the geographic distances, and to improve recruitment instruments to better balance uneven unemployment levels. The second example is between an old member state and new member state with a much lower tradition of cross-border cooperation, but you can see there has been quite some development already over the past years. Interestingly, this region shows quite opposite barriers and potentials for cross-border public services, because here we have language barriers, we have high economic discontinuities. At the same time, the geography really produces joint interests because of the mountain areas and the river basin. And these economic disparities are very much the reason why they are interested in looking into health and improving the accessibility of Czech residents to a German hospital, because that is much closer for them rather than the next hospital in their own area. Thank you very much.